I am Dr. Franklin Yao with Vanguard Vascular and Vein. In this short video, I will be going over our instructions for patients with varicose veins coming into our office for our venous ablation procedure. Thank you for tuning in. I will have answers to all your questions coming right up. Thank you for choosing Vanguard Vascular and Vein for your venous ablation procedure. In this video, I will go over what the procedure is like and what you can expect during the procedure. In addition, I will go over instructions for what you need to do in preparation for the procedure, as well as instructions for how to take care of yourself after the procedure. Prior to the procedure, a prescription for Xanax will be sent to your pharmacy. Please pick this up and bring it with you on the day of the procedure. Please take your Xanax approximately 30 minutes prior to your appointment time, and this will sufficiently relax you for the procedure. Please arrange for someone to bring you to and from your appointment. Wear loose-fitting clothing for the procedure. Disposable shorts will be provided to you at the time of the procedure. Blood thinners such as aspirin, Coumadin, Xarelto, or Eliquis should be continued unless otherwise instructed. Shaving your legs prior to the procedure will not be necessary. Please arrive approximately 15 minutes before the start of your procedure so that we can begin the procedure on time. When you arrive, you will be brought back to our vein procedure room. After you've had a chance to change your clothes, our medical assistant will sterilely prep and drape the leg that we are treating. If we are treating your great saphenous vein, you will be positioned on your back. If we are treating your small saphenous vein, you will be positioned on your stomach. Prior to starting the procedure, the consent for the procedure is reviewed with you in detail to make sure that you understand the risks and benefits of the procedure. After signing the consent, we perform a timeout for the procedure to review your allergies and to ensure that we are treating the correct vein. At the beginning of the procedure, I use an ultrasound to map out the vein along the course of the leg, marking it on the skin with a skin marker. The next step is an administration of a local anesthetic, usually with lidocaine with epinephrine. This usually feels like a small stick in a burn. This numbs up the skin so that the rest of the procedure is pain-free. After the administration of local lidocaine to numb up the skin, I place a small sheath into the vein out of dorsum guinus. Through this small sheath, I insert a radiofrequency ablation catheter into the vein to the part of the vein that I want to treat. The next step is the administration of local tumescent anesthesia that we inject around the entire vein that we want to treat. After tumescent anesthesia is performed, radiofrequency ablation catheter is activated to treat the vein for 2 to 3 minutes. After the vein is successfully treated, we remove the sheath and the catheter. Nothing is left behind. At the conclusion of the procedure, your leg is cleaned off and a small band-aid is placed over the insertion site. Your leg is wrapped in a multi-layer compression wrap that you should leave on for 48 hours. After the 48 hours, you can take off the wrap, you can shower, and you can wear a compression stocking. Please avoid taking a bath or using a hot tub or a sauna, or go swimming for the first week after the procedure. If you do not have any restrictions to taking non-steroidal anti-inflammatories, such as chronic kidney disease or GI intolerance, please take 4 200 milligram tablets of ibuprofen 3 times a day for 5 days. This medication decreases the inflammation from the procedure and helps in your recovery. If the medication upsets your stomach, please decrease or discontinue taking this medication. You may experience a little bit of pain and swelling, bruising, and tightness around the leg after the procedure. You may also experience a little bit of clear fluid draining from the injection sites for a couple of days. I recommend using a heating pad and compression stockings for the first couple of weeks. You can resume light exercise and walking right away, but I would avoid strenuous exercise for about a week. You can go back to driving and go back to work within 2 days, and you can resume air travel after 2 weeks. After a successful venous ablation procedure, you could expect your symptoms of pain and swelling to improve after 2 weeks. If you have a venous ulcer, you can expect that the ulcer healing will start to accelerate. If you have venous stasis skin changes, you can expect improvement in the discoloration in a couple of months. If you experience fever or chills, severe redness, pain or swelling of the leg, chest pain or shortness of breath, please call our office immediately and a physician will call you right back. Thank you for entrusting Vanguard with your varicose vein care. We look forward to taking good care of you.